Hello and welcome to Joy in Our Town, TBN, Kansas City. I am your host, Lindsay Hardiman, and today we are joined with Christal Watson of the Heartland Black Chamber of Commerce. Christal Watson, welcome to the show.
Thank you. I'm so glad to be here.
I'm glad you can join us. So let's open up and start by telling us a bit about yourself and your position with the Chamber.
Okay. Well, I am currently President and CEO of the Heartland Black Chamber of Commerce. And my responsibility is to pretty much be a liaison for the community in terms of our business members, connecting them with resources, opportunities to grow, expand, or connect their business. We interact with local, state, national government. We work with a number of corporate entities as well as, the very small business owners.
Okay, and what's the mission of this organization?
Our mission is to connect, grow, and promote business. So no matter what level your business is at, our job is to either connect you to the resources, to help you grow your business at whatever the next level is that you want to be at, and of course help promote your business.
Okay, and when was this chamber created?
So we've been in existence since 2005, and in 2012 we expanded. We moved downtown into the downtown KCK area, and just last year, April of last year, we announced be doing business as Heartland.
All right, that is amazing. So how can someone become a member of this chamber? Do they have to be volunteer? Are they elected? Or do they have any type of other type of standing in the community?
That's a great question. It's so easy to be a member. People can go to our website. They can go online, www.heartlandblackchamber.com. There is a form they can complete. And if they're a business owner, there's a business fee. And then if they're corporate or nonprofit, there's a fee for that. People can become members, not only just members, but they can become volunteers if they like.
Okay.
We love volunteers to help out with events, projects, or programs that we're rolling out or present to our members. And we just have some friends of the chamber, folks that just want to participate. They may not necessarily be a member or volunteer, but depending on what type of event is going on, they love to help out. And so we have a lot of friends that help.
Okay, so you said volunteers can help with different events. What type of events do you all have?
So every month we do a network or kind of an after hours, and we can utilize volunteers to help greet and help people understand the chamber. Then we participate with certain events, like we just did. We were at a conference, No More Excuses. Marquita Miller heads that, really doing a fantastic job. And so we were a vendor. And so we could use a volunteer to, participate as a vendor. Sometimes that really works well with some of our small business owners. If they can't afford a booth, they can sit with us, and that gives them a chance to share information about the chamber as well as their business. And then we do an annual luncheon. And so we have a luncheon coming up later this year in April or May. And we'll utilize a volunteer for that. And that's kind of a big event. We'll draw anywhere from 200 to 400 people. Wow. And so there's a lot to do when it comes to that. So those are some of the examples of what we would use a volunteer for. And then we can always use a volunteer in the office, just to kind of help with administrative tasks.
All right, so always looking for volunteers.
Always looking for volunteers.
All right, so I know earlier on you said you are connected to local and state government, but do you work with the city council?
So that's interesting. So how do we work with the city council? We work with the city council in that if there are some priorities that we want addressed, then I would go to city council members, some of our city council members. In Kansas City, Kansas, it's the commission board. In Kansas City, Missouri, it's the city council, right? And so depending on what initiatives and priorities that we want to go after, then I will pursue an interest with a particular commissioner or city council member, discuss those issues, initiatives, and see how we can work together.
Okay. All right. Now, can you tell me what is the Chairman's Circle?
So our Chairman's Circle, we're really excited. They've only been in existence for a year. And those are Black businesses that have the capacity to do business not only locally, but nationally or globally. We've got several large Black businesses that are very prominent within their industry, and this gives us an opportunity through the Chairman's Circle to highlight those businesses. And so we have a little magazine that we've done. I go to a conference every year in Washington, D.C. with the United States Black Chamber.
Right.
I'll take that magazine and show them who our top Black businesses are and if there's opportunity for their business to do business with them.
Okay. So the Chairman's Circle is made up of a group of members.
It is.
Okay.
They're all members of the chamber, and they're just they're businesses that can have the capacity to do large business, and it's our way of promoting them.
Okay. Well, we're going to take a few moments to put some information on the screen for our viewers at home. If you would like to contact the Heartland Black Chamber of Commerce, you can give them a call at 913-948-7680. Or visit the website on the screen at heartlandblackchamber.com. Again, that is heartlandblackchamber.com. All right, so we talked about the different events that you can all have, but do you all offer any programs?
We do. I am so excited to share with your audience some of the programs. One of our biggest programs that we're going to be rolling out is the loan program. It's the United States Black Chamber, USBC micro loan program. One of the key things to this program is that we're asking the business owner to take 15-week 3-course studies. It's an online program, but many times small business owners think that, I just need the money, right, to grow my business, when it's really so much more than that.
Right.
And sometimes when you get so engaged in your trade, you forget about all of the nuances to actually operate your business, that sometimes you need a refresher, right?
Right.
And so many times when you think that the answer is money, it may not be. And so when you take the course, you might find, wow, I probably really just need to streamline in this area or that area of my business. But we do ask that's part of the program, that they go through that course study, to receive their loan. And that's just like our number one thing we're really excited about. Some of the other programs that we have in place is our BEST program. It's our business, employment, and services training, where we are to help our business owners who need quality applicants, employees. We try to train people within the community to prepare them for those kinds of jobs. So we're really excited through that. We've trained about 100. We've certified about 136 residents under a federal program called Section 3. And about 33 of those folks we've helped train, and 27 of them just last year we were able to help them find employment.
All right. Okay, so we're talking about different business owners, but let's just give a scenario that somebody wants to start up a business and they have an idea in their head and they got the information from you to get the business started. Can they receive a license from you, or how do they go about that?
No, so they have to go through the normal channels of getting a license, a business license to do business.
Okay.
You've got Access Kansas, where you can go online there, or you can go through Kansas City, Missouri. They have business opportunities for you to learn more about business, going into business, and then can help create the pathway for you to get your business licensing. There are other resources too, like KC SourceLink. There's just a number of, you got SCORE. There are a number of nonprofit resources that can help a business owner get started in business. We will connect them to those resources.
Okay.
So we don't actually give anyone any certifications other than connecting them to the right resources to get what they need.
Okay, so as long as they're ready to get started, come
As long
to
as
you
they're ready,
and get started.
and we'll sit down with them. I will
Right.
sit down and go over what their ideas are, what we think will be helpful. We'll try to give as much guidance
Just map
as
out a plan.
Yes, but we don't necessarily do all of that in the office. There's plenty of other resources to do it.
Okay, so focusing back on the chamber itself, I know that you said it's in the downtown Kansas City, Kansas area, but are you looking to expand your focus?
Absolutely. So that was one of the reasons why we chose to become Heartland.
Okay.
So as a chamber leader and not being around enough minorities. So you have the Asian and you have the Hispanic chambers, but there wasn't any other functioning Black chambers. And so I found, wow, I need a lot of help, and I wonder if there were other Black chambers in the region that needed help. Right. And then when I went and did my homework, there weren't very many other Black chambers out there. So Heartland is a regional chamber, and so we're expanding our focus to not only Kansas, but Missouri, Iowa, and Nebraska.
Wow.
Yeah. So what does that mean? What that means is that eventually we will provide chamber support to Black chambers or minority organizations in those areas that need chamber support.
Okay.
Sometimes it's just about building an alliance, and as a regional chamber, that gives us a little more clout, if you will, to go into an area and say, hey, what is it do you need, and how can we help you, and how can we work together?
Okay. Well, we're going to take a few moments to put some more information on the screen. If you are just now tuning in, or if you would like more information about the Heartland Black Chamber of Commerce, please give them a call at 913-948-7680 or visit the website at heartlandblackchamber.com. All right, so in our last few seconds here, what can our citizens do to get involved and help our workforce development grow?
The number one thing I can say that I think would be helpful from a chamber perspective as a Black chamber leader would be to support Black business, number one. It is so important. We've got many Black businesses out there. Many folks don't know they're out there, or they're just not supporting them. And so I think for the Black communities to support Black business would be definitely huge. I think the second thing is to understand what the workforce needs are and to support those needs. There are many people within our community that are unemployed. Wyandotte County, for example, in KCK has the highest unemployment rate, and that's mostly impacted by people of color. So we need more support in training those people, getting them the training that they need so that they can, find employment. Okay. That's how we're going to really basically help with workforce. And then the other is transportation. I think transportation is huge. For those who are unemployed, who need employment, many of their issues is transportation, or it's daycare, how do I get my kids? But if you've got some large manufacturing or large industry firms that are further out or away from the bus line, getting to those jobs is going to be difficult.
Right.
And so our commissioners, our city needs some support in finding ways to find transportation for those folks so that the workforce needs for those companies can be met. Because they have a hard time finding, getting people to find, fill those jobs. Right. And those are entry-level jobs. Those may be warehouse or facility type work or construction, maybe even sales and data entry. But sometimes they don't tend to be on the bus line, and that makes it difficult for people to get to those jobs.
Exactly. All right, well, Christal Watson, thank you for joining us.
Thank you. I appreciate this so much.
We appreciate you. And thank you, viewers, for tuning in to Joy in Our Town, TBN Kansas City. I am your host, Lindsay Hardiman, and we'll see you next time.
SIDS affects infants less than a year old, with ages up to 4 months being particularly vulnerable. If the baby is sleeping in the bed with someone else, it increases the risk for SIDS, or accidental suffocation. Now, they can sleep in the same room with someone else beside the bed, just not in the bed. Nothing else in the sleep area. Remove all play items and soft objects from the crib at sleep time, and that includes bumper pads. Place baby on a firm, safety-approved crib mattress. Avoid overdressing your baby or setting the thermostat too high. And when it comes to sleeping, always, always, always place baby on his or her back. And get some rest, because you're gonna need it.
Colds, flu, pink eye. right, those are just a few of the parent concerns. Today, we are going to introduce you to one of our newest board-certified pediatricians from Heartland, Mosaic Life Care. I'm Kimberly Warren. Hang on to your seat. You're in for a treat. You are watching Joy in Our Town. Dr. Carmen Ford, welcome to the show.
Thank you.
It is so good to have you here.
Thank you. It's my pleasure.
You've been here just for a few short months now, and tell us how you're becoming acclimated to St. Joseph.
So far, so good. I'm really enjoying Heartland and my job and the town and meeting new people. It's great so far.
Wonderful. It looks like you're going to have a job for a long time. We're dealing with flu season again, and it's dragging out a little bit longer. I know there are a lot of concerned parents there.
Absolutely.
You not only treat children, but you also have tips and strategies and board certified for adults. Tell us about that unique combination.
So it's a combined specialty. So essentially we train in pediatrics and internal medicine and then board in both.
Wonderful. What type of advice do you have for the family when everyone is sick or the flu is running through the entire clan there?
Hand washing is number one. Good hand washing. Trying to stay at home, don't get out much when you're sick or your children are sick. That's really the big thing.
Wow, a lot of little kids may be sharing cups and bottles and plates and stuff. And so aside from hand washing, what are some of the tips and strategies that you can give parents to eradicate not just the flu, but other germs that we pass back and forth?
So I always tell parents it's not possible to protect ourselves from one another, especially when we live in the home together.
Right.
But again, the hand washing, keeping surfaces sanitized, trying to quarantine the sick child from the rest to the best of your ability.
Right. What is the overall goal and mission for the pediatrics team at Mosaic Life?
So for us pediatricians who provide care for the children in the Heartland care area, our number one job is to take our best care of the children. But we also like to support and encourage and educate parents and families at the same time.
That is fantastic. Let's talk about some trends that have been going on for hundreds of years, and are they outdated or are they embraced now more than ever before? So let's start with breastfeeding. We have all this technology where you almost can manufacture the breast milk or order it somewhere.
Sure.
And to breastfeed or not to breastfeed, does it really help the immune system?
So the short answer is yes. The AAP still recommends exclusive breastfeeding for at least the first 6 months.
Okay.
The perfect world would be breastfeeding for 1 year, even after we start to introduce foods. We know that there are a lot of benefits for baby and for mom with breastfeeding, and so those continue. So again, the recommendation would be, yes, breastfeed.
Okay, what about circumcision?
Circumcision.
Some cultures do, some don't. And
yeah. So the AAP has recently updated their policy in the last year or two. Essentially what it says is that the benefits do outweigh the risks. Some of the benefits we know exist: a decreased incidence of urinary tract infections in the first year of life, decreased incidence of sexually transmitted diseases later in life.
Okay.
The policy also has a caveat, though, that says the benefits don't outweigh the risks enough to have a blanket statement that says every male newborn should be circumcised. At the end of the day, it's a parent choice.
Wonderful. That may let some people feel at ease today.
Sure.
Now, what about vaccinations?
Vaccinations. So definitely a pro for me. I'm a big believer in vaccines. The CDC and the AAP agree on a vaccine schedule that helps us know when and which vaccines to give. This is recommended for all children across the board with very few exceptions. We know that there are small and rare risks associated with vaccines, but the benefits far outweigh the risks and make it really, really important.
Wonderful. If you're just now tuning in to Joy in Our Town, our special guest is Dr. Carmen Ford. She treats the entire family, the adults as well as the children. If you have questions for her that we may not get to today or would like to contact her and ask her team about the services that they offer our community, you can go straight to the website to learn more about them, or you can just give them a call. And the number to the office is 816-271-8155. That's 271-8155 with Dr. Carmen Ford. Let's talk a little bit about childhood obesity. There's been a lot of information over, because of the current administration, that tends to be the initiative, the end-all be-all. So are we getting better with it? And what tips and strategies do we have to kind of prevent childhood obesity and diabetes?
Sure. Huge issue. Overall, we're struggling. Over the last 20 years, the number of children that are obese has doubled. The number of teens that are obese has tripled. So those numbers alone tell us this is an important issue. Some things that families can do at home to combat obesity are simple. Eat breakfast every day. Have dinner as a family at the table, at home. Decrease sugary drinks in the house. Increase fruits and vegetables. One thing we forget, we talk a lot about diet, but we forget about activity. Limiting screen time is important. That's computer time, TV time, video game time. So limiting those so children are out playing and getting exercise.
And since your focus is not just on the kids, how do we include the entire family in those activities instead of saying, little Johnny has to be on a diet today? No, he can't have cake and everyone else can have it.
Sure. And that's what I try to tell people. This has to be a family affair. Everybody has to be on board. You know, mom can't cook 3 meals for different dietary needs. You know, that's just not practical. So I think making the family a team is what's important.
Okay, wonderful. Let's talk about a new practice when babies are born. You know, we already have to deal with colic and umbilical cords and to save the blood or not to save it, but now there is a new procedure to detect congenital heart defects. So can you tell a little bit about this very common birth defect?
Yeah, so as of January 1st of this year, the state of Missouri has mandated a new screening. It's actually called Chloe's Law, named after a child that had a congenital heart defect.
Okay.
Essentially, it's a screening that's very simple. It's a small probe that goes over the finger or the toe. It measures the oxygen level in the baby's blood. We compare a couple different sites. In a normal, healthy child, those numbers would be the same. When those numbers are not the same, it could be a sign that there is a congenital heart defect. The reason it's really important to catch this early is because we can prevent some of the long-term complications that could show up down the road by repairing the defect as soon as possible.
Fantastic.
Yeah, it's important to note Heartland's been doing this screening for about 5 years, and some other hospitals in the area as well. Now it's mandated. Every newborn born in the state of Missouri has this screening.
Wonderful. I know you could probably get hundreds of calls in your office with new mothers just being a little bit overprotective, but how do you, at what point do you say it's time to give this baby antibiotics or to bring them in? Is it a cold? Is it pneumonia? Is it RSV? What do you tell the parents in regards to gauging themselves and when to bring that kid in for a doctor's visit?
So that's a great question. A few rules of thumb. The younger they are, the more conservative I am. Okay, new babies, any concern at all, it is never the wrong answer to bring them in.
Okay.
Let me check them out. Let me put you at ease. You know, take a look at the baby. That's a tough question when you talk about children that are older. I always tell parents, if you are concerned, bring them in. I'll never say, gosh, you shouldn't have brought them in today.
Right.
Never, you know. That's what I'm here for. I'm here to ease your concerns, answer your questions, help guide you along the way.
Wonderful. What's the most common question that parents tend to ask you or new parents?
You know, for new parents, it's probably something along the lines of what is normal, right? Babies do all these things that parents aren't used to, and they don't know, is this abnormal with my baby, or is this something all babies do? So I actually love having that discussion. You know, hiccups is a great example. Babies can hiccup for hours, and parents don't know if that's normal or not.
Right.
Most often it is. So I like to have that discussion. These are some of the things you're going to notice that might concern you, but it's normal.
Right.
That's a fun visit for me.
Wonderful.
Yeah.
Well, you're new to the community, but I'm sure you know about Heartland Pound Plunge, and I'm a member of that.
Yeah,
I'm going to be the winner this year.
We're doing it in our clinic as well.
Wonderful. What do you think the community can contribute to make us healthier overall? What can we do either as families or businesses to ensure we prevent diseases and just make us an overall healthier community?
Sure. I think the general principle that we need to follow is trying to implement healthy habits earlier on so that we carry them into adulthood and we're not having the same battles in adulthood we may have had earlier in life. Making healthy food choices, healthy eating, increased physical activity, again, as a family. And, you know, good sleep habits are important too. all of these together make us a healthier community.
That is wonderful. One more time, we're going to put the information on the screen. Your phone's going to be ringing off the hook.
Okay.
If you have questions about the pediatric service or family care services for your family, Dr. Carmen Ford is one of the newest med-peds, you call it med-peds?
Sure.
For adults and pediatric care at Heartland, now Mosaic Life Care. You can simply call her office and ask them any questions to see if this is appropriate for your family. The number is 271-8155. That's 271-8155. They also have a wonderful website where you can find out a lot of preventative tips and strategies to help keep your family healthy. So we talked about what to do to keep the family healthy. What if there are already diseases and ancestry, you know, stuff we may develop, high blood pressure from my grandpa, cancer from someone else? And how do you break those generational cycles? We already have bad eating habits. We may already have some poor, healthy lifestyles. What is the best tips and strategies do you have for our viewers today to break those bad habits or cycles?
Great question. Again, we go back to the healthy lifestyle, maintaining a healthy weight, watching what we're eating, seeing the doctor regularly. I hate to say that. Those are all important things to combat those familial diseases that can be in our families.
I'm sure you probably heard people say before, I don't want to hear what the doctor has to say, or what I don't know won't hurt me. And what do you have to say to them in regarding early prevention or intervention when they know they have a health challenge?
So that's a great point. Prevention, I think, is the key. Let's prevent things before they happen. Have those discussions, talk about screenings that are recommended for, for different ages and that kind of thing. Prevention is the key.
Prevention's the key.
Yep.
Now, you're from St. Louis area. Did you see some models that were working for St. Louis that you would like to adopt here, either with the walking trails or working together as a team in your office? You mentioned Pound Plunge.
Yes.
We'll give another plug for that.
Yeah.
What did you think was working there that also is working here to make us a healthy community?
You know, I've actually been in Kansas City most of my adult life. I moved right after high school.
Okay.
So most of my experience comes from Kansas City, but I think you bring up a good point. There are a lot of trails and parks and in this part of the state, which is wonderful. We have the walkway here in St. Joe, which is great to get out and about.
Wonderful. And working together as a team with your office helps too, doesn't it?
Yes, motivate each other.
Well, Mosaic Life is doing a wonderful job, and we thank you for sharing a lot of healthy tips today.
Yeah, thank you for having me.
In closing, we want to put the information on the screen just one more time if you didn't get it earlier. Again, Dr. Carmen Ford is our board-certified pediatrician as well as certified in adult medicine. And you can reach her at 271-8155. That's 271-8155. I'm Kimberly Warren, and we thank you for watching TBN, Joy in Our Town. Have a wonderful week. Be healthy, be wealthy, and wise.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telephone dollars. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.